into conference. After joining the call, to record the conference for those who may miss this call, or for future playback, press star 2.
Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined with Dr. Joss Reimer, Medical Officer of Health and Medical Lead for Manitoba's COVID-19 Vaccine Implementation Task Force. Today we're announcing 4 additional deaths due to COVID-19, 1 from the Northern Health Region and 3 from the Winnipeg Health Region. I'd like to extend our condolences to their families, friends, loved ones, caregivers. Our current 5-day COVID test positivity rate is 10.6% provincially, 7.3% in Winnipeg. 118 new cases of the virus have been identified as of 9:30 a.m., bringing our total number of confirmed cases to 27,629. The actions of hard work by Manitobans continues to make a difference. We see our numbers having some way of fluctuating over the days, but we're seeing they're headed in a good direction. Today's numbers continue to be encouraging. We're definitely not out of the woods. We certainly still have a long way to go before we can return to normal. If we let up now, if we increase the amount of close contacts we have, we're going to see those numbers climb again. We need to keep going in order to keep our numbers down, and we can see our healthcare system starting to get back to those elective surgeries, but we have to keep our numbers down so our healthcare system can be there for all Manitobans. We're going to start our reopening process. We need to do it in a continuous fashion, in a cautious fashion. We don't want to yo-yo. We don't have openings and then require closures again if our numbers get high. So we're going to do so very cautiously, being mindful of the fundamentals, which are going to be something we need to have in place for the foreseeable future. Staying home when we're ill, hand washing, physical distancing. These are all things that we're going to have to be mindful for the next many, many months. People who are pending test results basis. This is in addition to the phone calls from contact tracers and those automatic phone messages. This will alert Manitobans that their test results are available on Manitoba COVID-19 online result display. Second, I'd encourage all Manitobans to stay home as much as possible. However, donating blood is still very essential, and donations are especially needed after the holidays. So please consider booking an appointment through Canadian Blood Services, and also that although we're advising Manitobans to stay home as much as possible, if you need medical care, do not hesitate to seek it out. Our healthcare institutions are safe. Your healthcare provider is safe to visit or visit virtually, but do not put off your healthcare needs due to the pandemic. So thanks to all Manitobans for your hard work. I'm going to pass it over to Dr. Reimer.
Thank you, Dr. Roussin. Good afternoon. I'm Dr. Joss Reimer, Medical Officer of Health and the Medical Lead on the Vaccine Implementation Task Force. First, let me congratulate all of the people who have been involved leading up to the opening of the super site in Brandon. I have heard great things about how things have gone so far today. I know that the first immunizations were given at about 8:30 this morning, so big thank you to the team there. On Friday, Manitoba learned, along with other provinces, that the Pfizer vaccine shipments from the federal government will be delayed. The task force began working immediately with our stakeholders on Friday, as well as the health system, to look at the impact of those delayed shipments and the schedule from Canada. Thankfully, we did not need to cancel any appointments that were already scheduled. However, we wanted to quickly stop making new appointments to ensure that all of the appointments that were made could be honored. And so we wanted to give ourselves some time to look at the impact of those delays before opening the call center back up. We have been continuing over the weekend to meet together and to look at the numbers and recalculate and update our strategy in light of the Pfizer disruption. So today, I can confirm that after spending the weekend looking at those numbers and the future reduced Pfizer deliveries, we calculate that we should have enough doses of Pfizer vaccine to book an additional 4,000 appointments. So that will be occurring this week and next week in Winnipeg and in Brandon. We are also planning to go forward with opening the site in Thompson on February 1st, but this will be on a temporary basis while supplies are in place to run that site. We are also going to be holding off on opening the Vaxport portion of the Thompson site, again because we are awaiting further supplies. For the time being, we are not taking appointments for the Thompson site, but I will let you know when that changes. So as I said, every Manitoban who already has an appointment to be immunized can keep that appointment, whether it's for a first dose or a second dose. This is really a direct benefit of the planning and careful procedures that were put in by our task force to ensure that we had enough supply to honor appointments when we know that the federally sourced vaccine supply can be unpredictable. So we did not overextend. We did not assume that the future supply would arrive. And because of that, we're not canceling any appointments or delaying any of our second doses. We're really thankful to have gone through this process, and I want to thank the team for their hard work to not have to delay anybody's second dose. We also want to make sure that we clarify that we're continuing to follow all of the protocols as outlined by the manufacturer, because we want our healthcare system and our most vulnerable, so our top priority groups, to be fully vaccinated and fully covered. So these delays are obviously disappointing, but we also want to make sure that Manitobans know that as soon as supplies resume, Manitoba is ready to offer the vaccine to everyone within the supplies that we have available. So based on the updated analysis, we are planning to start taking appointments again starting tomorrow morning. However, as I mentioned, right now we're going to be booking for Winnipeg and Brandon, and I will let you know when we can start booking for Thompson. I do want to make sure to clarify also that this delay does not affect our schedule for personal care homes. The data reported on Friday was accurate, but we know that there are delays in getting the numbers from personal care homes. And so we will be continuing to update you as we get those numbers on the number of residents who were immunized. What I can tell you today is that 10 personal care homes had their residents immunized as of the end of the day on Saturday. And actually, we expect that we will be completing the first dose of immunizations for all PCHs about 1 week ahead of schedule. So that will be by the end of January. We will be visiting 51 personal care homes next week as part of that accelerated schedule. In addition, I also want to clarify that the uncertainty around Pfizer does not affect the commitments of Moderna doses that we've made to our First Nations communities. We do plan to have more details in the briefing on Wednesday to discuss all of the things that I've just gone through, as well as our inventory management plans. But with so much changing as the result of the Pfizer announcement, I thought it was very important that we give an update to Manitobans today about what we know so far. I am confident that our plan is sound. We are not willing to sacrifice safety for speed, and our program will continue to move forward as supplies are available. So we can now take questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and 2 follow-up questions this afternoon. Up first, from the Winnipeg Sun, Scott.
Good afternoon to both of you. Dr. Reimer, have you, so over the weekend, what's changed, if anything, with this Pfizer delay? What have you learned? Has there been any new information as to when maybe doses will start, filtering into the province again?
So we got some clarity on the new expected allotments, and we're being told that we're going to be getting about 28,000 fewer doses over the next 4 weeks than what we were originally told. So over the weekend, we took a look at those 28,000 doses and had to do some reevaluation of how many got sent to each of the 3 centers and make sure that we knew that we would have enough at each of those centers to continue with the appointments as booked, and that we would have enough at those centers, given the future shipments that we're expecting, that the second doses for all of those individuals who are booked would also be available.
Okay, thanks for that. Dr. Roussin, this week we're expecting new public health orders by, I assume by Friday we'll know them. Hospitalizations have dropped, but have they dropped enough at this point to, I guess, manage the risk of loosening restrictions going forward?
Yeah, so certainly our numbers, both in overall cases and in hospitalization numbers, have improved. They're trending in the right direction. I think there's still lots of reasons to be cautious. One is that there is still that demand on our healthcare system. Our healthcare system is now just getting back to some of those elective procedures. So we do have to be cautious as we start to roll things out. And in addition, we look at some of the trends surrounding us through the country. And so we do have to be cautious. We do think that we're in a position to start with some loosening of the restrictions, and we'll have some more details on that as the week goes on. But absolutely, we need to be very cautious.
Thanks for that. And my last question is, we haven't got any modeling of what it's going to look like in the next month or so. We've asked, you guys have asked Manitobans to give their opinion on reopening. I struggle to see how people can make an informed decision or an informed opinion on that based on not really knowing what the future kind of holds if we do open up. Will we see any modeling this week, and why haven't we seen any, kind of going into a time where it's expected that at least some restrictions get loosened?
Yeah, I don't think we're going to have updated models this week. The issue with that is, models have their limitations. I think they're good to look at, to give that sense. But when you're going to change the variables that the model uses, then they're less reliable, right? So if we look at a model of where we're going to be with these restrictions, then that model quickly expires at the end of this week if we change any of those restrictions. So I think that Manitobans have been dealing with this for quite some time. They've seen what happened during our first wave. They've seen what has happened during the first parts of our second wave. So I think it's quite a valuable endeavor to get some feedback from Manitobans, not only for what we're going to be doing at the end of this week, but to help guide us as we move forward, because we do want to be cautious, but we do want to have that gradual reopening. We don't want to go backwards.
From CBC Radio Canada, Gavin.
Hi, Dr. Reimer, Gavin from Radio Canada. Question for you about care homes. Can you give us an idea of how many vaccine doses have been administered in care homes? You did say 10 locations, which is more than the 7 you had planned to be at in the first week, but I'm just wondering if you could give us an idea of how many doses that represents.
Thanks. That's a great question. I can't give you the exact number that were given last week, but I do want to take the opportunity to explain a little bit about why some of that information is delayed in our personal care homes. So when we are talking about the super sites, we actually have our immunizers working with a laptop right in front of them, where they can directly enter data in while they're seeing the person in front of them. So that information reaches our system the same day as that vaccine goes into the arm. And that's why we're able to give such up-to-date numbers from our super sites. Unfortunately, we can't do the same thing when we're in remote locations. So in a personal care home, for example, our immunizers are going room to room and can't carry a laptop with them. And in some of our personal care homes, there may not even be internet access, which also goes for a lot of our remote and isolated communities as well. So after the clinic is completed, the next day the team will then go and make sure that all of the data is entered into our system, which then reaches us that day, and we can do some analysis and collate it and get it the following day forward. So we're always about 2 days behind in the data because of those delays in the way the data goes into the system. So I don't have the total up-to-date numbers for last week on the number of residents. What I can say is of the 10 sites, the uptake was very good. We had very few people who declined the vaccine, and we were able to reach and complete more sites than we originally had planned.
Thank you for that. A question for you, Dr. Roussin. What's the situation like in Lynn Lake and other communities in northern Manitoba that are seeing a lot of virus right now?
Yeah, and so we're still seeing outbreak situations in a number of northern communities and in First Nation communities. And so there's a lot of work on the ground with the rapid response teams, rapid testing, a lot of work right now on alternative isolation accommodations because it's very important to get those cases and contacts isolated, break the chains of transmission. So you can see our numbers that today we're showing a slightly downward trend, but we're still concerned about those outbreaks in the remote settings.
Was the curfew in Lynn Lake a recommendation of public health?
It wasn't a direct recommendation from public health. Public health will issue our, public health restrictions and orders. So we haven't did that specifically. I think that the basis behind these restrictions is really to decrease the number of contacts people have. And so in different settings, there may be different applications of that work best. And so, so I think, a curfew has always been discussed, and we see that in other jurisdictions. So, the real issue is finding ways to limit the amount of contacts.
From CBC Manitoba, Bart.
Hi, Dr. Reimer. When will you be presenting a vaccination dashboard that will have your Pfizer shots, plus the personal care home Moderna shots and the First Nations Moderna shots?
We are planning to launch a dashboard this week. So I'll have further details on Wednesday about exactly what's going to be included and when you can expect to see it. But that is the plan for now, is to have a dashboard available for Manitobans so that they can see for Pfizer and Moderna what has been provided this week.
Okay, great. Thank you for that. When will there be online appointment bookings for vaccination?
I don't have that information in front of me, so I'll have to take that question away and get back to you on that information.
Thank you. This one's for Dr. Roussin. Doctor, what new measures or policies or assistance or help will be given for isolated communities up north? We've got a worsening situation of disparity here in Manitoba. We have almost half the active cases are in the north. Island Lake Health District alone, nearly 500. There's only 9,000 people in that health district. So what new policies and new assistance is coming for the people of northern Manitoba?
Well, I mean, the things that we have in place, they just need to be enhanced, right? When we're dealing with public health issues like this, what are the main goals, right, is case identification, isolation, contact identification, and isolation. And so those concepts don't change, and the approach to them, there's not much new to it, right? We just have to have increased access to testing, which we have the rapid response teams on board. We have now, we're trying to provide more public health nurse support right on the ground there to help with contact tracing, and then we've expanded our alternate accommodations to try to be able to isolate people away from the community, whether they're infectious or isolating as a contact. So those are the main points, and so there isn't, necessarily a new approach. It's just enhancing our ability to do those priorities.
From the Canadian Press, Steve.
Good afternoon. I was wondering if I might be able to get an update as to the total demand for intensive care beds, both COVID and non-COVID. I assume we're still well above normal capacity.
So I have some numbers in front of me. If we look at the current ICU patients that are active COVID, it's 23. And current ICU patients that are listed as recovered from COVID is 12, giving us a total of 35 in the ICU. If we look at those numbers related to overall hospitalizations, it's 135 active, 154 recovered for a total of 289.
Yep. But in terms of total demand on intensive care beds, including people who have nothing to do with COVID, normally our capacity is about 75 or so, 75, 80.
Yeah, I don't think I have. The total beds that are used right now. Lynette will probably be able to provide those numbers. I just have those that are related to COVID.
Okay, thanks. And as you consider opening up cautiously later this week, what have we learned about the new variant and its rate of transmission, and does that impact your decision on reopenings?
So the new variants, the UK variant, for sure appears to be much more transmissible. Has a greater affinity for our cells due to a mutation in the spike protein. So definitely we want to avoid the introduction of these variants. There doesn't appear to be any issues with vaccine effectiveness or in severity of disease, but certainly they appear much more transmissible. So I think that what's happening around us in the world is always something we have to consider. So we know we have the federal travel restrictions. We have some self-isolation requirements to the east of us. We're requesting that all returning travelers do get tested upon arrival to Manitoba, and then again 7 days, whether they're symptomatic or not. And so we are concerned about those variants. We have not detected any of the variants in Manitoba to date, but we're watching quite closely.
From CTV Winnipeg, Michelle.
Hi. I have a question for Dr. Roussin, or maybe Dr. Reimer, whoever wants to take it. So we've said there are some pre-existing health conditions that would require enhanced consent process before getting the vaccine, and you guys are still working on procedures. So I'm wondering, has anybody been told to wait for this process to be ready, and when will this enhanced consent process be rolled out?
Yeah, so the National Advisory Committee on Immunization did provide advice that people with autoimmune conditions, people who are immunocompromised, either because of conditions they may have or treatments that they're taking, and those who are pregnant or breastfeeding, not be routinely offered immunization. They have changed their wording a little bit recently to allow for some enhanced consent, as you mentioned, in order to be eligible for the vaccine. And so Manitoba has been working very hard to have that process ready to go. For right now, when someone calls the call center and mentions that they have one of those conditions, they are being asked to wait. However, we are close to having a process in place that would allow them to move through the booking process and on to a more thorough consent, where we have an opportunity to talk to them about both the risks and the benefits for them in general, as well as related to the condition before they make a decision to go for immunization. I will be able to have some more information on Wednesday about this, so please do ask again.
Okay, I have a question about the Doctors Manitoba survey that shows doctors really want to be involved in the vaccination campaign. I guess, why haven't doctors been used so far? And will you take their recommendations into account, specifically the list of priorities, making that public for the vaccination so everybody can see where they are in the queue?
Yeah, we were very excited to see the results of the survey and how supportive the doctors were of the vaccine itself and of having mechanisms to roll it out to Manitobans. So it's wonderful to have doctors so engaged in in their desire to move forward with this. We are having meetings right now with several representatives of different organizations, from physicians as well as from pharmacists, about how we could do a more distributed model if we had a vaccine that safely allowed for the transportation and storage throughout the province. So those conversations are happening right as we speak, and we are working on having a model that we could implement immediately should one of those vaccines be approved and available in Manitoba. We are also working on coming up with a priority list that will be slowed a little bit based on Pfizer's disruption. So we need to go back and look and make sure that we're not jumping ahead to provide Manitobans with information that we wouldn't actually be able to honor. But we are still working on that list so that all Manitobans can see where they are in the queue, and we will have that available as soon as we can.
Okay, and then my last question is about the survey that we did over the weekend. How many Manitobans did the survey, and when will we be able to see any of those results, or what might come of it? Because I believe they said early this week we could see some of those results.
Yeah, I don't have any specifics on it. I think from initial reports, the Manitobans were highly engaged in this survey. So I think we'll probably have more details on that tomorrow or later on in the week.
From City News, Jonas.
Good afternoon, folks. Dr. Reimer, first question is for you this afternoon. Just want to touch on a note that we received on some 500 people this weekend getting a text message for an appointment for a vaccine with the wrong site. I guess just a note on this, and if people do miss an appointment because of an error like this, is there any sense that a vaccine can go to waste? I guess, what are just some of the protocols in place for that?
Yeah, so that's a great question. We do ensure that regardless of whether or not someone were to miss an appointment, first off, they would still be eligible to, under the current eligibility criteria, to rebook that appointment. Second is that we have very cautious procedures at our clinics in place to waste the absolute minimum number of doses possible. There are always going to be last-minute cancellations or no-shows for any clinic that we set up, as well as people who, after having an opportunity to discuss some of the risks and benefits to themselves, who may choose not to be immunized at the clinic after having that discussion with the immunizer. So when we're at the clinic, we are always making sure that we have prepared only enough doses for the individuals that are there, which means that there are staff who are consistently throughout the day preparing further doses. The vaccine can be stored at room temperature for up to 5 days, but once you puncture the vial, that shortens down to hours. And that's why we only puncture the vial when we have people coming in front of us, and do it throughout the day so that we're not wasting any of those vials because somebody didn't come or didn't choose to be immunized for a variety of reasons.
Thank you very much for that. Vaccine supply, we're all kind of scrambling. Have we looked at, I don't know, like say the Chinese Sinopharm or anything like that to get an idea on its effectiveness, or do you get a sense that we might be looking at something like that in the future?
Well, Health Canada is really leading the way on the approval process. So we would, in Manitoba, wait until Health Canada has approved whatever product we would use here, because we need to ensure that it is safe and that it has gone through all of the regular approval mechanisms that are in place to keep our vaccine program safe and effective. So we're not going to introduce anything that hasn't gone through that rigorous process. That said, I am aware there are multiple different companies that are currently in the process of going through that approval process. In some of the cases, Health Canada has asked for additional data from them. In other cases, we're still waiting for some of their trials to complete. But Health Canada will, as soon as they've approved them, they'll let us know, and we will start to move on having those available.
Thank you very much for that. Final question, Dr. Roussin. Today, Winnipeg recording its lowest daily total since mid-October. Just a note on what we're seeing here in the capital, and it seems like Winnipeg is heading to a better place for sure.
I think the numbers are encouraging. Certainly, we're quite concerned about the outbreaks in the Northern Health region, but if we look at most of the province, we're seeing the numbers go in the right direction. And we see that trend directly connected to the increased restrictions, and so we just know this virus is going to we're going to see transmission of this virus the more contacts we have. And so when the restrictions are in place, we see those numbers go down. We're now allowing our healthcare system to get back to some elective procedures, certainly not back to pre-COVID levels. But so there's a lot of encouraging here. But we also have to remember that we have to be very cautious moving forward. If we start losing track of those fundamentals, like we did back in October, if we increase the amount of contacts we have, we're going to start seeing those numbers climb.
From CHVN, Taylor.
Good afternoon. Dr. Roussin, I think all of my questions are for you today. Now, over the weekend, that survey saw over 63,000 responses. What are some of the common themes you're seeing pop up?
So I think we're going to provide a good wrap-up over it, so I don't want to just pick and choose the things that I saw. So I think it's very encouraging to see the amount of engagement. So Manitobans are very interested in this, but we'll provide some more details on that in the coming days.
I've heard that some businesses are seriously preparing to open up this weekend. When would they get a notice of this?
We're going to try as early as we can this week to give that signal. We know that businesses, appreciate, some of that, prior notice to get things moving. So we're going to try to do that as early as we can this week to give that notice.
And can you give us any idea of when faith gatherings will be allowed again, whether it's this weekend or even sometime soon?
Yeah, I'm not going to speculate right now on exactly what these orders will look like or what the next set would be. We have to, remember that how this virus is transmitted, right? Enclosed spaces, close contact, prolonged indoor contact. So, those factors need to be considered as we start to reopen. And again, we want to do this in a continuous fashion. So we're going to do it cautiously. We don't want that yo-yo effect. We don't want to be opening things up only to have to pull back on it. I think that Manitobans want to see us do this cautiously, but move forward continuously.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, my first question is for you, and I think you sort of alluded to this earlier. When we talk about our hospital capacity outlook, I was wondering if you could describe what you're thinking might happen based on the rate of infection in the north and in remote communities, knowing that hospitalizations occur at a greater rate among First Nations.
Yeah, and so this is another, reason for us to be cautious. So we're quite concerned about those outbreaks. We're concerned that we're seeing the increasingly disproportionate effect on First Nations, and so we're there's a lot of engagement happening right now to try to limit the impacts of these outbreaks, but we do have to be very cautious about also the burden on the healthcare system as we see these outbreaks occur.
Okay, thank you. And you've talked about while our COVID case numbers are encouraging, we're not out of the woods yet. Can you describe, I guess, how close we are to being at a point where we can control the clusters and contain them, both in Winnipeg and in the north? Are we close to having COVID spread considered under control?
Well, we're certainly in a back into a containment mode right now, where case identification, isolation, contact investigation, and isolation are very important at these numbers because we can, once again, these public health measures can play a major role in trying to diminish the transmission. And so, so certainly when we're dealing with, cases in the 400 or 500 range, contact tracing is difficult. So where we're at right now, these factors are quite important, but we are many months away from from a place where we can start thinking about getting back to anything resembling being normal. So this virus is here. We have some hope with this vaccine rollout. and certainly these numbers are encouraging. So make no mistake, there's going to be an end of this pandemic. We are going to get out of this, but for the next many months, we're going to have to continue to be vigilant.
Thanks. And I was wondering if you are aware of the Manitoba Métis Federation's testing site for its members, and whether this effort has been tied into the provincial public health system, and if you can comment on that at all.
Yeah, no, I don't have any details on that.
From Global News, Brittany.
Good afternoon. It's Brittany from Global. Dr. Reimer, do we have any further information on how long the Pfizer vaccine delays are expected to last for here in Manitoba?
The best information we have right now is that we can expect that over the next 4 weeks, we're going to have substantial reductions in the amount that is delivered to Manitoba. I am certainly hopeful that after that time that our supply will return to normal. What we're hearing from Pfizer and the federal government right now is that they're hopeful that in March they will be able to resume and possibly even increase the allotments that they were previously providing for us. So we're hopeful that by the end of March we'll reach back to the original numbers that were assigned to Manitoba. But we will certainly have to wait and see how things go at the Pfizer factory to get a better idea of when we'll get those final numbers.
Thank you. And Alberta says they expect to run out of their current doses today or by tomorrow morning. When does Manitoba expect to run out of the doses we have, and when are we expecting our next shipment?
I will have more details on Wednesday to go through the exact inventory plan, but what I can say is that we have enough doses to go through this week's appointments, and then other than that, I'll get more details for you on Wednesday.
Thank you. And Dr. Roussin, my next question is for you. Everybody obviously anticipating when next public health orders come out. Is there anything right now that you can for certain say to people, this is off the table, this will not happen, so people can start to wrap their heads around it?
Well, we're going to have more details tomorrow on that. I don't want to provide any specifics today. What I can say is that we are going to take a cautious approach to this. We do not want to open things up too quickly, see those numbers go up, and then have to take a step back. You know, we're fully committed to trying to do this in a continuous manner, but that's going to require a lot of a cautious approach to opening things up.
From the Brandon Sun, Michelle.
Good afternoon. The Premier mentioned when he was in Brandon last week that he's interested in seeing a full list of prioritization for the vaccine, though he does defer to the task force. The NDP leadership has also mentioned the same regarding a full list of the order of vaccination for the population. Any plans on releasing such a list?
So we do, we do plan to release a list. We're currently working on our prioritization list. Our plans have been delayed a little bit because of the Pfizer disruption, but we will be releasing that information as soon as we can.
Thank you. From my understanding, the Moderna vaccine efficacy, I may be pronouncing that wrong, in participants 65 years of age and older appears to be lower than in younger adults 18 to 65, 86.4% compared to 95.6%. Considering First Nation elders are top of the list for vaccination, is this on your radar at all as an issue? Also, I mean, the question would apply if any personal care homes are using Moderna.
So we are constantly looking at the data that's provided by the companies as well as by other jurisdictions, and we will be sure to analyze it on an ongoing basis. What we have right now shows that it's a very effective vaccine, and we are confident that it will be beneficial to those who are receiving it.
Okay, thank you. And this is a reader's question. People who work at a COVID testing site are eligible to receive the vaccine. why aren't people who work directly with COVID-positive clients at alternative isolation accommodations included in the eligibility criteria?
So we have looked at a number of different issues when it comes to determining the eligibility criteria. We looked at issues like whether or not the people would potentially be exposed to the virus in the workplace. We're also looking at how vulnerable the patients or clients in that setting might be. So for example, for personal care homes, it's essential that the staff be immunized so that they're not a source of infection for the individuals living in that setting because they're more likely to experience severe harms. We're also looking at where we've seen evidence of outbreaks and disease transmission, particularly between staff and residents or patients. And we're looking at where we have specialized workforce with specialized skills or those where any work disruption would be quite critical to the system. All of those factors have to be considered at the same time. So one of the reasons that the COVID immunization clinics became a priority was around that workforce issue. It is critical that these clinics be up and running with as many people as we need in order to give every vaccine as fast as we can. And so it was important that not only that we have the eligibility in there to help recruit some of the workers to that location, but also to prevent that from ever becoming a source of infection. So the last thing we would want for Manitobans is to have one of our vaccine clinics become the site of an outbreak. So we wanted to ensure that we were protecting everyone who was working there, as well as protecting everyone who was coming through to get their vaccine.
From CJOB, Will.
Doctors. Dr. Reimer, just for clarity on your opening statements there, you said you have enough vaccine to book, I can't remember, 5,000 or 6,000 more appointments. So does that mean you have enough for both first and second shots, or are you counting on the shipments resuming before then? And also, do you expect you'll book more after that's expended?
So we have enough inventory together with what we have on hand right now, as well as what we're still expecting to get in future shipments, to book an additional 4,000 appointments on top of what have already been booked. So that would potentially be first or second dose appointments, but that is in addition to existing appointments.
Okay, thanks for clearing that up. Also, I'm just wondering, why has it taken so long to establish a vaccine prioritization list? Like, can you give us a little more insight into your process there?
So as I said, we're trying to look at a lot of things at the same time. We are looking both within the healthcare system and the healthcare workforce and trying to ensure that we are providing the vaccine to staff based on a number of different factors. We look at whether or not they're a critical or specialized workforce. So for an example, there is our lab technicians who work with COVID-19 specimens. If we were to have an outbreak in that setting and didn't have those lab workers available, that would be a very substantial blow to our system and our ability to manage COVID going forward. We also want to look at the risk to staff and the likelihood that they would be exposed to COVID-19. One example there is how we opened it up to the COVID-19 designated hospital wards, because we know that the majority of patients there either are or were infectious at some point while being cared for on that ward. We also need to look at the vulnerability of the patients or clients in that setting, and that's where you'll see why personal care homes, for example, were included where the staff are eligible, because we want to protect those folks where we've seen that they've demonstrated that they are at higher risk of severe outcomes related to COVID-19. And there's other factors as well, so all of those are going into the decisions at the same time as we're looking at the population overall, and we want to be giving a vaccine to the highest risk individuals in the general population on top of the healthcare workers. So that's where our personal care home residents have been prioritized, as well as our First Nations communities. Both of those groups have experienced disproportionate harms, disproportionate severe outcomes related to the infection, so it was important that they get prioritized right from the get-go. Now, what's complicated about the remainder is that we want to also base it on the science, on the numbers, on the epidemiology, as well as the numbers of doses we have available. And we want to do so in a way that is clear to Manitobans, and so that we can have an expectation that when Manitobans see their category, that they know that that is a trustworthy source of information, that they will be eligible when Manitoba says that they will be. So because partially of the disruption, as well as at the beginning, because of the unknown supply that started in December, we've done things slowly so that we can interpret the science, but also do so in a way that's reflective of what we know about the inventory that's going to be coming in. So as I said, we had been hopeful that we would get that list, very shortly out. With the Pfizer disruption, we want to take a second and take another look at that again, so that we can ensure we provide accurate information to Manitobans and can follow through on any commitments that we make.
Okay, thank you. And I also have a question about the Doctors Manitoba survey that was released earlier. It shows a majority of physicians want more information about the vaccine in regards to safety and effectiveness, and a slightly fewer amount want help addressing vaccine hesitancy. So does the task force have a role to play in this respect, and what might that look like?
Yeah, the Doctors Manitoba survey, one of the things that I found particularly helpful about it was that they outlined what types of tools physicians would find most useful when it comes to vaccine information. This survey was just released, so we're going to take the information that they provided and take that back to the task force to start looking at how we might be able to develop, in partnership with the physicians, how we could develop some of those tools, because we absolutely want our physicians, our nurses, our pharmacists, and all of our other immunizers to have every tool that they need to provide accurate information to their patients, to their clients, to help inform Manitobans about this vaccine, to demonstrate how safe and effective it is, and then for those few people where there might be some risks that need to be considered, that they have the tools in front of them to be able to have that conversation with those patients.
From the Steinbach Carillon, Jordan.
Hi, good afternoon. It's Jordan from the Steinbach Carillon. Question for Dr. Reimer. Now that the Winnipeg and Brandon vaccination clinics are up and running, I'm wondering what is the estimated timeline for Steinbach's vaccination site, and what might its daily capacity be relative to the other two?
Yeah, I really wish I could give you that answer today. We did have some early discussions around future potential sites. All of those discussions have been put on hold with the Pfizer disruption. Now that we're looking at everything being pushed back 4 weeks, and that's assuming that things resume when we're being told by the federal government that they will resume. I don't have any information about when to expect future sites to open.
Okay, thanks. And a question for Dr. Roussin. Just looking at the provincial dashboard, the Red River South Health Reporting District, which encompasses the area between Highway 75 and Highway 59 down near the U.S. border, has 32 active cases. Most of the other health districts in the southeast region are low single digits in terms of active cases. I don't see any facilities or institutions in that health district listed as having an active outbreak, and there aren't many large communities in that area. Do you know what's behind that active case count in the Red River South District?
I don't have any specific details on it. I know that we have to be cautious when looking at our active case count. It's usually an overestimate. Usually the priority isn't taking the active cases off of our surveillance lists. So we'll look further into it, but I'm not aware of anything specific going on there.
Okay, thanks. And my last question, again for Dr. Roussin. With Southern Health as a whole seeing daily new cases in the single digits, but high case counts and infection rates in other parts of the province, are you considering regionalizing the province's transition out of Code Red, perhaps by health authority, or is the plan to exit from Code Red altogether as an entire province?
Yeah, so that's not off the table. I think we want to try to get back to that regional approach. I think it's challenging when you're in a red and seeing the numbers that we had to take a very regional approach, because there's a lot of mobility. But I do think our goal moving forward is to get back to a more regional approach when appropriate.
From the Thompson Citizen, Ian.
Good afternoon. Dr. Reimer, have any vaccinations taken place at the personal care home in Thompson yet?
So I don't actually know the location. There has been immunizations that occurred at St. Paul's residence, which is in the Northern Health Region, but I don't know where in the Northern Health Region that location is. And additionally, our First Nations partners have also provided immunizations to some of their personal care home residents. I don't believe that those were located in Thompson, but we would have to confirm that with them.
Okay. Yeah, St. Paul's is in Nepal. Is there a schedule for when vaccination will start at the personal care home in Thompson?
I know that we're planning to do 51 personal care homes in the next week. I don't have the list of those in front of me, but we can get that.
And do you have any? I know the Thompson vaccination site is going to open on a temporary basis, I think you said. But do you have any idea how long the permanent opening of it will be delayed as a result of the Pfizer vaccine delays?
Well, right now we're planning to send up one tray of Pfizer vaccine, which contains about 1,100 doses. We have to send, the transportation requirements from the manufacturer dictate that we have to send a full tray together when we're sending something frozen. So that number of doses will be going up to Thompson, and will ensure that the site is open to facilitate providing all of those doses. So it really depends at this point on how quickly appointments are booked and what the uptake is from folks in the Northern Regional Health Authority, and that will help us determine how long the site will be open. After we have better understanding of when we can expect resumption of the higher amounts of shipments, we'll be able to decide about sending up further doses than that first tray.
Thank you, everyone. This concludes today's media briefing.